Now, let me introduce Dr. Sanath Hettige. I don't think that he needs a very big introduction because most of us know him well. Dr. Sanath Hettige is a consultant in family medicine and holds a degrees of Bachelor of Medicine and Surgery, postgraduate diploma in family medicine, and Doctor of Medicine in family medicine from the University of Colombo. He holds a qualification of Fellow of the College of General Practitioners as well. He is an honorary senior lecturer for Faculty of Medicine, University of Colombo, Kothanavala Defence Academy, and the Faculty of Medical Sciences, University of Sri Jayantha, and he was the former chairperson of the Board of Study in Family Medicine for the Postgraduate Institute of Medicine of University of Colombo. Dr. Hettige is not only a doctor, he is an inventor and a business entrepreneur as well. He is the chairman or the managing director of Oil of the Dengue Group of companies. He is the chief scientist of Oil of the Dengue Laboratories and the Dengue Research Medical Center. He has won several national and international awards for his interventions where he has contributed to the field of medicine, including the Presidential Award for the Best Medical Invention for the year 2013. Dr. Hettige is a life member of College of General Practitioners and he held several positions. He is presently a council member of the Independent Medical Practitioners Association as well. He was the former chairman of the National Issues Committee and the current chairman of the Health and Nutrition Committee of Organization of Professional Association. He is one of the professionals who has been heavily involved in dengue prevention and control in the country. Currently, he holds the position in the National Advisory Committee for Communicable Diseases and was one of the authors for developing the dengue guidelines. President of the OPA, Secretary General of OPA, the distinguished guest, let me invite Dr. Hettige to present his presentation on Protect Yourself from Dengue and what is new. Over to you, Dr. Hettige.
Thank you for that kind introduction. My presentation will be very short. Most of what have to be said about dengue was told by Dr. Sudath Samaraweera and Dr. Jayantha Weeraman. My duty is to explain to you few practical points which is of very important to the general public, for the general population, who are non-doctors. Some very practical points which will be very short, but it will be very important to control the dengue spread in our country and to protect ourselves from dengue. Now, this whole thing is there because mosquitoes are biting us. So if we can protect somehow ourselves from the mosquito bites, whole this thing about dengue will not be there anymore. So but just simple this insect can cause so much of problem. So if we can protect ourselves from dengue, from the mosquito bite, we can do a lot. So one of the most important thing is in our house. If somebody is having dengue, this was told earlier also, I like to emphasize on that, we have to make sure that he is not bitten by mosquitoes and this mosquito doesn't bite the other people in the house. So because we see in one house 2 to 3 people come to us, so it's a big burden for the family where 2 or 3 people in the houses have got infected. So if we could reduce the mosquito density in your house and in your environment, at least when you see that one of your family members have got dengue, we can reduce this type of spread. As it is, if you have a dengue patient, you have to inform the PHI who will do the fogging and reduce the outside mosquito density. Don't worry, now they won't take you probably to the police station or fine, but they will come and fog and try to reduce the help the spread. So if you have a dengue patient in your house, please use a mosquito repellent. There are mosquito repellents which you can use, vaporizers, so that that person may not be bitten, and the spread to the we can reduce the infection of mosquitoes and reduce the incidence that other family members of your house get. But of course, we must understand that there are a lot of asymptomatic infections also, where 70% of people show no symptoms. We may be having dengue and we may be spreading it due to mosquito bites, but we may be not knowing. But protecting ourselves from dengue is very important from the mosquito. For example, now for when we have seminars like this, right, in schools, why don't you put 1 or 2 vaporizers to protect people by biting? These are practical points which we have to do, and that will definitely reduce the spread. So you have to reduce the density in the environment and in your own house. So I told you I will explain how you can protect the mosquito density in your house in a very practical way. Right? The other way is to wear protective clothing, use mosquito repellents, methods to destroy the adult mosquitoes. So actually this everybody knows about this, to stop mosquito breeding places, which was dealt earlier. Sometimes destroying the adult mosquitoes may be more effective than trying to destroy the larvae. Now the world has tried to destroy the larvae breeding places, but it has not succeeded very much. I am not talking about the bio control, but just try to reduce the breeding places of mosquitoes, which is not an easy thing, because even as Dr. Sudath said, even small quantity of is enough to for them to breathe. So we can try to destroy the adult mosquitoes, because from one adult mosquito they can produce about 300 eggs. So you produce about 300 mosquitoes. So fogging and things down. Actually, in places like, you can use mosquito bats, like where you can destroy the mosquito before occasion. Now we see in hotels, lot of mosquitoes are there. So we must aim at destroying these mosquitoes. Not that it will prevent 100%, but it will have a good impact. Now, how could you reduce the mosquito density in your own house? It's a very simple thing, right? Now, how does the mosquitoes come to your house? Through the lure. Through the lure only mosquitoes comes into your house. So, if you can cover this lure with a simple mesh, your mosquito density in your house decreases. You yourself can do. You don't need, you can just take a small mosquito and glue it around, and immediately you can reduce your mosquito density in your house, and you can protect yourself, and you can protect others also. Now see, you can, in this way, you can actually, you can put this mesh and prevent the mosquitoes coming in, right? And so what we should actually do is, right, when we are building house, we can have a large window, right? A small glass. Now usually this is the type we have, a large window and a small lure. So to get air, we tend to open this window. So what we can do is, instead of this, we have a large lure which is covered with a mosquito protective net, and have a small flicked glass. So therefore, the mosquitoes will find it difficult to come in, and your house will be almost free of mosquitoes. So these are the things which you can do actually. And these things actually, what I think is, these should go into architectural plans and considered when giving approval to building plans, to make sure that the lures are covered. So if we just say it won't happen, but if it goes into architectural approval procedure for these things, it will have a long-term effect. The other thing is to ensure that your child wears protective clothing when you are going out, right? How many of us tell our child to wear some socks and clothes and go out? We must emphasize that, especially when you are living in a dengue endemic area, and that will definitely reduce the bite of mosquitoes. So when they are going to play, just tell them to wear some shoes and trousers. So that will protect mosquito bite, and that will reduce the transmission also. I mean, it won't protect 100%, but surely there will be. Now in schools, a lot of girls have to wear uniform, short uniforms, and I know even prefects say not to put the socks up. That's the way. But actually, if you can put at least the socks up, that will give some sort of protection. Or you can wear leggings or some sort of pants under the uniform to protect at severe endemic time of dengue, right? So now this is the normal way. See, why not wear like this? See, we have shoes, we have leggings. So this will definitely protect this thing, because I know there had been a study done abroad where you put insecticide on school uniforms, and the incidents were reduced. So you don't need to do that, but you can cover them. Here, even boys, make sure that when your child is going out, to wear socks and shoes. These are some practical things. This we know, mosquito vaporizers and things. So that's right. So this one part of my lecture is over. This is I want to tell you practical. And my other duty is to summarize very briefly what Dr. Sudath Samaraweera and Dr. Weeraman has said. Very few things. If you get fever, this is very important in your family. If any one of y'all get fever, please think that it is going to be dengue. And if somebody is having fever, dry fever, in my experience, there are two forms of fever we normally can have. Dry fever without no cough and cold. The other one is we have cough and cold and rhinorrhea. Dengue mostly is type of dry fever, because the dengue virus does not multiply in your respiratory system. It generally multiplies in your bone marrow, reticuloendothelial system. So you don't, very rarely, normally you don't get cough and cold. But of course some cases you can have. So if somebody gets fever, dry fever, think that it is dengue and go to your doctor. Not like good olden days where, dengue was not there and you can wait for 2 to 3 days. And my advice, you can tell your colleagues whom you are representative of so many organizations, get fever, don't wait at home. First day itself, go to your general practitioner and sit. They can do a test called NS1 antigen test, and almost 99% you can say whether it's dengue or not. So if you know if it is dengue, then as Dr. Weeraman said, he will know, the doctor will know how to manage. So that's the most important thing. Be aware. And if you are diagnosed with dengue, have bed rest, don't go out. And the most dangerous day is when your fever is subsiding. That is the time your pressure can drop and you can have all the complications. Not like other fevers, when the fever is dropping we are happy. But in dengue it's not that. In dengue, if the fever is dropping, we could be happy and unhappy both. Because sometimes fever drops and you are okay. But sometimes fever drops but you become bad. Your appetite doesn't improve, you become weak, and that is the time you have to do full blood count and see if your platelets is dropping. Immediately you have to get admitted. And and they have actually our doctors have the pit unit, they have done a lot of things and improved on the management. You can be 99% sure that if you get admitted at the proper time, you can be saved. So it's very important to see that. And you may have to do full blood counts. If you are diagnosed with dengue, you have to do full blood counts almost every day. So you have to go to the doctor and he will tell do. And there will be a fluid restriction and they will tell you how to drink your fluid. So that's important to participate that, and not to take ibuprofen, brufen and these painkillers. We have, I think, given you a copy of this. Please take this and give photocopies to all the organization which you all are representing, and in your websites, and to follow the guidelines given in this if you get dengue, and that will protect everybody from getting into severe disease. And that's all. Thank you very much for listening.